Okay, ma, now see. Select the incorrect match regarding the specific disorder of muscular or skeletal system. Option 1, myasthenia gravis. It is autoimmune disorder which inhibits sliding of myosin filaments. See, myasthenia gravis, it is an autoimmune disorder, that is correct, but it will not inhibit sliding movement. Actually, it inhibits neuromuscular junction, transmission of nerve impulses from muscle to another nerve. That process is stopped. As a result of that, our body gets fatigue, weakness, and maybe chances to get paralysis. So option 1 is wrong. Okay, autoimmune disorder, but it will not inhibit sliding of myosin filaments. Okay, it will not stop. So option 1 is wrong option. Gout, inflammation of joints due to extra deposition of calcium they have given. It is also wrong option. Actually, gout disease. Gout disease what? Inflammation of uric acid. At the joints, inflammation of uric acid leads to pain, and there is a chances to get inflammation of joints. That is actually, but they given another option. Therefore, second option is wrong. Third, muscular dystrophy, age-related shortening of muscles. They said it is not age-related. Muscular dystrophy. In this one, what happened? It is a genetic disorder. In this genetic disorder, gradually, muscles gets degenerated, destroyed. Okay. Therefore, third option also wrong. If first, second, third options were wrong, then ultimately fourth option is correct. See, osteoporosis. It is decrease in bone mass and higher chances of fractures. Higher chances of fractures with advancing age means what? Old age. So the correct option is fourth option is correct. So 29th correct option is 4. 30 question. 30 question. Myasthenia gravis involves weakness of skeletal muscles. Actually, myasthenia gravis disease, it weakens the skeletal muscles, our skeletal muscles. So, which of the following can act as a primary treatment of it? So, to get it, myasthenia gravis in normal position. For myasthenia gravis, it is a skeletal disorder. From that skeletal disorder, if you wanted to get cure, what is the primary treatment? So actually, it is not there in our syllabus. This treatment they did not give in our syllabus. But also no problem. See, third option. It is an injection of acetylcholine esterase inhibitor. Acetylcholine esterase, it is one injection title, name it is. So to treat myasthenia gravis disorder, if we will get this disorder, if we will get this injection, in our body myasthenia gravis disorder gets to normal position. So in this disorder, what happens? Muscles fatigue, weakening. That fatigue and weakening, if it is continued, there is a chances to get paralysis. So that weakness and fatigue, if you wanted to get treatment, so doctor will suggest acetylcholine esterase. Okay, so that is inhibitor. Okay, that's that. So third option, correct option. 30th question, third option is correct. 31st question answer. The clavicle articulates with, see ma here, pectoral girdle. This is pectoral girdle. Pectoral girdle consists of two halves. Each half consists of two bones, clavicle bone, scapula. clavicle bone and scapula. The scapula consists of a slightly elevated ridge that is called spine. Below the spine, there is flat projected portion that is called acromion. Acromion. So you see here, the clavicle articulates with acromion process of scapula. The scapula has a slight elevated ridge called spine. Spine, below the spine, there is a flat projection that is called acromion. Spine is attached to the acromion. So below the acromion process, there is a cavity that is called glenoid cavity. That glenoid cavity helps to articulate this humerus to the pectoral girdle and forms shoulder joint. In this case, the correct answer is acromion process. 31 question option is first. Pectoral girdle, if you study thoroughly, then you can keep answer. So for this, no secret, no boost. Okay, ma'am? So that is. So why not remaining? They asked about the clavicle articulates. Articulates means attached with the acromion process of scapula. So this clavicle attached to the acromion process. So that second option is not correct. Glenoid cavity. So glenoid cavity is not related to this. Acetabulum. Acetabulum, it is related to pelvic girdle. Ball and socket, hip joint and shoulder joint. Hip. So ball and socket means what? Hip joint means what? Pelvic region. We will sit that joint, hip joint. Next, shoulder joint. Shoulder joint. That is called ball and socket joint. But question is not related to that. Therefore, second, third, fourth options were wrong. Next, 32 question. Sternum is connected to ribs. See, these are ribs. This is the sternum. This sternum is connected to ribs by. If you study sternum topic, then you can say ribs. Bony matter, not bony matter. White fibrous cartilage. White fibrous cartilage in this region is not present. So 1 and 2 absolutely wrong answers. Hyaline cartilage. See, ribs. These ribs are connected to the sternum. Through here it will be present. Through hyaline cartilage. Through hyaline cartilage, side ribs are attached to the sternum. In between sternum and the ribs, there is a cartilage that is called hyaline cartilage. Hyaline cartilage. Therefore, the correct option is third. So, areolar tissue, that is another that is present in this region. Okay. So that hyaline cartilage connects ribs to sternum. Therefore, the correct answer is pectoral girdle. Therefore, second option is wrong. Glenoid cavity, already many times I said, glenoid cavity. Below the acromion process, here, below the acromion process, there is a cavity. That cavity is called glenoid cavity. In the glenoid cavity, humerus join. This humerus join and forms a shoulder joint. So, glenoid cavity is explaining about the pectoral girdle. Therefore, third option is correct. Let us see 4. Ilium, it is related to pelvic girdle. So, first, second, fourth option not related to pectoral girdle. Third option, glenoid cavity is related to pectoral girdle. Therefore, 33 question, correct answer is 3. Total number of bones in limb. Limb means hands, legs of ours is. Can you say anybody? Option 1, 24 wrong. Option 2, 30. Each limb is made up of by 30 bones. We discussed that. So second option is correct. 14, 21, these are wrong. Each limb contains 30 bones. 34. Each limb contains 30 bones. 2. So 35. 35 question answer. Ossification of tendon. Ossification. Ossification of tendon. Already in regular lesson I said that. So ossification means soft tissue. Soft tissue or fibrous tissue gradually hardening in tendon and forms a bone that is called sesamoid bone. Sesamoid bone is also called patella. So 35 question option is 1. Sesamoid bone. In material it was there. If you study get to know that. But ossification not there. Ossification not there. Write down. Ossification not there. Soft tissue within the brackets. Fibrous tissue becoming calcified. Becoming calcified and hardened. Hardened. That is called ossification. Okay. So in tendons made up of by fibrous tissue. That fibrous tissue gradually calcified. Calcified means what? Calcium is deposited. That calcium is gradually hardened. That process is called ossification of tendon. Results: sesamoid bone. Sesamoid bone is also called patella bone. Kneecap. Knee joint is covered by a cap. That is called kneecap. Therefore, the correct option is first option. Why not remaining? Cartilage bone. Cartilage bone. Cartilage bone is also called replacing bone. Okay, but in that place, knee joint is covered by cup-like structure. The cup-like structure is sesamoid, not cartilage. Investing bone. Investing bone, it is not. Investing bone not there. So investing bone, where formed? Formed in the skin. Formed inside of the skin. Okay, that's all. So third option wrong. Fourth, replacing bone. Replacing bone, nothing but cartilage bone. Okay, cartilage bone is also called replacing bone. Therefore, second, third, fourth options were wrong. Correct option is 1. The joint between atlas and axis. What we will call? You say pivot joint. Only Amresh. Out of 34, only Amresh. Remaining members also involved. These are all not new. Already I have finished. No, everybody involved. The joint between atlas and axis is called. So option 1, angular joint. So angular joint is present in between metacarpals and phalanges. In between metacarpals and phalanges, that is called angular joint. But they have asked atlas first vertebral column, atlas second axis, atlas and axis. About that they are asked. So option 1 is wrong. Hinge joint, that is explaining about knee joint. Shoulder joint and hip joint is called hinge joint. Okay, second option wrong. Pivot joint. Pivot joint is joint between atlas and axis is called pivot joint. So according to the question, third option is correct. Let us see fourth, saddle joint. Saddle joint between carpals and metacarpals of the thumb. Carpals and metacarpals of the thumb. That is called saddle joint. So according to the question, the correct option is third. In which of the following fractures the bone is broken into more than 2 fragments? with some of the fragments losing connection with blood circulation. See, actually, fractures topic they did not give in our 20th chapter. But when the bone discussion comes, they must give about fractures. How many types of fractures? What are simple fractures, complex fractures, about that. But they did not give. No problem. So in the old book, it was there. In previously, this is a bit asked. So that they given in this chapter, no problem. In which of the following fractures? There are given 4 types of fractures. Among those fractures, the bone is broken into more than 2 fragments. Number of fragments. The bone is broken into number of fragments. With some of the fragments losing connection with blood circulation. In some fragments, the blood circulation is lost. What is that? First of all, let us see compound fracture. Compound fracture, bone out of the skin. In compound fracture, the bone is completely comes out. That is called compound fracture. Option 1. The bone only will come out, but the muscle broken, the muscle is cut. Okay, but the blood vessels are not cut. So that according to the question, the correct answer is not 1. Let us see green stick fracture. Green stick fracture means what? The bones crack, the bone is cracked, but where the crack happens, where the fractures happen, at that place looks like a greenish color. That is called green fracture. So according to the question, second option also not correct. Third, comminuted fractures. Comminuted fractures. Comminuted fractures means what? In comminuted fractures, the bone is cut into number of fragments, and also due to that number of fragments, the blood supply also lost. So that according to the question, the correct option is third. Fourth option, let us see. Simple fracture. Simple fracture. The bone break into separate parts. The bone is broken into separate parts, but blood circulation does not stop. Therefore, the what only saying the meaning? Simple fracture. The simple fracture, small fracture, it can cure immediately. Okay, so that among those 4 options, the correct option is comminuted fractures. In this one, the bone is cut into number of fragments, and also blood circulation is stopped. Okay, so that's 37 question. The correct option is yes, ma'am. 4 fractures only. Types of fractures are 4. Okay, so actually it was there in old syllabus, but in your reading book is revised textbook. In that the fractures of bones and the vitamins topic they eliminated. Okay, actually, yes. Formation of abnormal granules called panas. So the panas are secreted by synovial membrane. In case of what disorder? So formation of abnormal granules, this bit also out of syllabus. Okay, so from this chapter, since the beginning of exams, what type of bits they have asked, those are all given. So 1 or 2 bits beyond our syllabus comes, so no need to worry. You will get new information. Okay, so whatever the a layer of vascular fibrous tissue extends over the surface of an organ, especially cornea. Or are any of other organs. any of other organs. By synovial membrane. By synovial membrane. In case of synovial membrane, in case of rheumatic arthritis. Rheumatic arthritis. Rheumatic arthritis disease. So when we are suffering rheumatic arthritis disease, in that disease, suddenly any of our body parts, so vascular fibrous tissues are formed. Either eye or joints, various joints are present. Okay, those are called palmas. So that is formed by the synovial membrane of the synovial membrane. If we are suffers rheumatic arthritis disease. So according to the question, the correct answer is 2, rheumatic arthritis. So apart from this PANAS, the persons who are suffering from rheumatic arthritis disease, such people often suffers from joint pains, inflammation of joints. Inflammation means swelling with the pain. Swelling as well as pain. We are unable to stand, we are unable to sit, we are unable to walk properly. That is called rheumatic arthritis, joints, pains. So that correct answer is 2. So about remaining options also knowing is important, being a biology student. See, osteoarthritis, it is also a type of arthritis. Rheumatic arthritis, it is one type of arthritis. Osteoarthritis, it is one type of arthritis. Write down there. A type of arthritis, osteoarthritis. It is a type of arthritis that occurs when a flexible tissue at the end of bones come down. When flexible tissue at the ends of bones come down or out. Come down or out. That is called osteoarthritis. A type of arthritis that occurs when flexible tissue at the ends of bones come down or out. That is called osteoarthritis. See, here in between these two joints, in between two knee joints, a kind of a flexible tissue is present. That flexible tissue is in between, like this it will be. This is called flexible tissue. This flexible tissue comes down, comes like this, comes completely a side or out, like this, comes out. That is called osteoarthritis. It is also like rheumatoid arthritis, but osteoarthritis infection is very pain. A kind of a burning sensation comes. So in such cases, knee replacement surgery they will suggest, doctor will suggest. Okay, so that is osteoarthritis. So gout, everybody knows that. Osteomyelitis. That means inflammation of spine. So spine. So some people will get spine pain. So such people's lumbar vertebrae, front. So lumbar vertebrae here, exactly abdominal region, lower abdominal region is called lumbar vertebrae. At the lumbar vertebrae region, they will get a vigorous pain. At that time, they cannot stand, they cannot erect like this. So like that, they will stand. They are unable to stand, they are unable to walk, they will creep on the ground. So that means what? Osteomyelitis, that infection, that disorder name is osteomyelitis. Osteomyelitis, what actually affected organ? Within the brackets right now. Inflammation of spine. Inflammation means swelling with pain. Okay? That's so this much enough. you take in higher education other branches in MBBS, then you will learn complete information. So with this section C, previous year's questions completely finished. So assertion reason type questions. Assertion reason type questions means they will give one statement, that they will give assertion. That assertion, one statement, it will give one statement. Reason, it will give one statement. If assertion, reason both are true, we have to keep one type of answer. If both are wrong, one type of answer. So that